Hello, and welcome to the Northwest Community Health EMS EMT Education Program Open Enrollment. This course here is we're just going to kind of review the program, give you an idea of everything to expect moving forward, and try to answer any questions ahead of time for you. So kicking off, let's go ahead and look at our program overview. So at our organization, Harris County ESD 8 is actually our company and taxing authority, but we are branded as Northwest Community Health as a forward-facing brand. Brian Biani is our chief, and he oversees the overall function of the organization as a whole. I myself, Eric Steffel, am the Director of Clinical Practices and the Division Chief here. Jonathan Coyle is our clinical educator who oversees all of our clinical education programs, including our staff education as well as programs such as this. Valerie Ursalo Soto, she is our primary EMS education instructor for the classrooms. So she is going to be your number one person and go-to from this point forward. She is going to be the person in the classroom the most and will be overseeing your education process throughout the entire program. We also have a handful of education adjunct instructors that come in and help. Most of these are staff within our organization that are 911 providers on a daily basis. So the EMT program. This program is an introductory level course. So the purpose of everything that we have built and asked you to do through the education process is to get you prepared as an entry level EMT getting into the field. So we meet and exceed all of the standards that are required by the state, and there's some places that we actually do go a little bit beyond and extra because it does facilitate understanding local practices a little bit better. The training consists of multiple topics, medical terminology, pharmacology, anatomy, physiology, patient assessment, EMS operations, and putting all of that together and being able to run a call all the way from getting on shift, going on a call, getting back, and ending your shift. So this course is also designed, you do not have to have any medical experience. You do not even have to have a CPR card as part of this because all of that training and education does come in with the program as we continue and as you progress through the program. At the end of the course, and this is a key piece here, at the end of the course, you will receive a course completion, not certification. Our course completion here, as any other EMT program, that course completion allows you to sit for the National Registry Certification Exam, and we're going to talk about that a little bit later. So our course is typically about 14 weeks in duration. We do 1 day a week. Each class is may be a little bit different, depends on holidays for that cohort, but usually either a Monday or a Wednesday night, but can be any day of the week depending on each class. And then alternating Saturdays, typically every other Saturday. The weekday classes typically start at 6 p.m. And go for about 3 to 4 hours, and then the weekend classes start at either 8 or 9, depending on the publication for that class, and you'll see it on the schedule. And some things about the course we're going to discuss on the next slide. So clinicals, our clinicals, you have a total of 96 hours of clinicals. 24 of them are in the hospital. We have various hospitals in the area that we go to. You will be going to the emergency department, and you'll do 2 12-hour shifts there. During these shifts, your goal is to focus on getting familiar with treating patients in the healthcare setting in a controlled environment. And then once you do those several shifts, you'll go out to the ambulance 72 hours. It can be done with 12 or 24-hour shifts or a mix of both. And we have various contracts throughout the area. And when we get closer to that time in the class, we will discuss clinicals much more heavily. Right now, it's just kind of an awareness of what the workload is. Some things to remember, though, is they are completed outside of the classroom, and that does consider a strain with you're already taking 1 day a week plus your study time at home and when we get into clinicals, doing clinicals at some point in time throughout the week or weekend. All emergency department and ambulance rides can be done at any time, any day of the week, 12-hour shifts, typically 7 to 7 a.m. to p.m. and p.m. to a.m. And there's some places that do vary with a 6 a.m. or other unique. Again, those options will be discussed with you later. In the classroom, it is about a 50-50 online in class. We are doing the flipped hybrid classroom where your online platform, which is JB Learning, it houses a lot of the online learning materials. Now, the flipped classroom, it is really important for you to spend that time doing JB Learning and what you need to learn to come to class, because when you get into the classroom, it is more focused on hands-on application and skills about what you've already read and learned about. So what that means is, traditionally, if you're used to more of an older school or traditional classroom, you come to the classroom to get the information. And in the flipped classroom model, you gain the information, you expose yourself to it before you come to the classroom so that you can spark some discussion, have some time having discussions about practical application, a little bit of discussion about understanding, but then focusing a majority of your time on practical application, hands-on skills in the classroom, and that helps kind of bring it all together. There is some lecture that is part of that in the classroom, but we really do our best to try to minimize that lecture so that we can focus more on hands-on. If you come to the classroom and you've not done any of the pre-work and expect to come in and the classroom time teach you everything you need to know, that will greatly hinder the process. So we want to be up forward and up front. JB Learning does have a lot of online learning material, pre-recorded lectures. There is an ebook, there's an audio section for that where we'll read it to you. Whatever your learning style is, whatever works best for that, we do have options there. And again, all your tests and quizzes are hosted on JB Learning, and that's pretty straightforward. So testing. In your exams, all of our tests to be successful need to be considered a 70% or higher. And what is considered a fail, we have two subcategories to fails. So the first is you must at least achieve a 50% on your exam. And the purpose of this is if you score under a 50%, odds are you did not prepare for the exam and you get exposed to that exam. And then you can come back in and could come back and traditionally be able to retest. And that's not fair. So what we have adopted is if you do not achieve at least a 50% on your first attempt, then that score will stand on your grade book and you will automatically be placed on probation. There are no repeat attempts at all for that module. So for example, module 1, you come in, you take the exam, you get a 45. That means you were automatically on probation and your grade for that test stands at 45%. Now, if you score in that 50 to 69 range, then you're eligible to retest one time only. So let's play this through. If you come in and score a 62% on Module 1 exam, you need to retest. So you come in and retest, and you get an 85%. Congratulations, but the highest score recorded will be a 70% on that second attempt. Now, let's say Module 1, you come in, and this goes down to the third bullet point here, where violators of the second violation of either one of those. So for example, if you come in and you take Module 1 exam, you get a 60, and then you come back in your second attempt, you get a 68. Now you are put on probation, and you cannot have any further second attempt fails or less than 50. So basically everyone gets one. If you are a violation of the first or second bullet point, that means you are automatically placed on probation. We have automated basically what historically what that is you are dismissed from the program, and then we are automatically appealed and placed back into the classroom on probation. Any further violations of the first or second bullet points will result in dismissal for the program without appeal because there was already an automatic appeal. This seems complex. Don't worry, we're there. We're going to be the ones guiding you through this, but at the same token, just understand we need to see some effort because the entire program is designed to get you ready for National Registry exam. And if you're not passing these tests with some level of quality, then that means you're not going to be ready to pass our final or be able to pass National Registry. So testing is important, and again, we'll walk you through it. Just to kind of give you a layout of the process between certification and licensure, all of this is done towards the end of the program. So upon passing the course final, this is what you will work on, and we will be there. This is just an overview. You don't have to worry about memorizing this. We have an entire class night dedicated to this process later on. But you will fill out your National Registry application, and there's two parts in there. There's skills and course completion. Once you get your course completion, then we will work on, you get a National Registry voucher, and then you'll schedule your test at a Pearson VUE testing center. At the same time, or you can do it after, either way, you fill out your state application, and usually we do it in class, that way we can work through. It's not always the easiest application to fill out. Then you have to get your background check and fingerprint done, which again, I believe that's around in the $40 range. Again, that price may vary a little bit depending on the vendor. But and again, we'll discuss this later, you have to go through a specific process. Once you have National Registry, you've passed it, then that does not mean that you are licensed. That means you have a National Registry certification. You have to wait until your state application is completed and approved, and once both of those come together, then you will have your Texas Department of State Health Services, so your Texas EMT license. So again, we will walk you through this process, but it's just kind of letting you know that at the end of the class, you complete the course. That does not mean you're an EMT. There is a certification and licensure process after that. So requirements for enrollment, you need to be at least 17 years old, high school diploma or GED, basic computer skills. So you, a lot of the courses online, so being able to work with Word, PDFs, being able to send images back and forth, shot records, so on and so forth. Criminal background check, if there's anything of concern, there's nothing I'm going to be able to tell you specifically other than unless there's a capital murder charge or something significant that I can tell you definitely that would be excluding you from the process. If there's anything in concern, then go ahead and get with Valerie or one of us, and we'll direct you to a contact at the state, and you can have that conversation with them directly. They will not give you an answer until a criminal background check has been completed, mainly because they will not issue a definitive response until they have all the facts. So pass a standard 10-panel drug test. You can look it up in Google with a standard 10-panel drug test, what all is on it. That's pretty straightforward. Proof of physical exam. It does not have to be anything extravagant. It could even be just a sports physical. We just need a physical that will be less than 12 months by the end of the course. Purpose of that is largely for our clinicals and some of the stuff we do in the classroom. We need to make sure that that physical is within 12 months at any given time while you're throughout the program. There are times that we do implement an entrance exam, so if that is the case, then Valerie will reach out and let you know what the next steps are. And then all of your enrollment documents, and we're going to talk about that a little bit more in a second. So all of our education is primarily held out of our Administration of Education building here, 29530 Quinn Road. However, our administrative building just received this new designation address of 29510. It's right next door to our current administration building. So satisfactory academic progress. What this means is what allows you to stay in the class and what triggers are there for you to be dismissed from the program. You need to maintain a cumulative grade of 70% or greater throughout the course. Anytime you drop below that, we can issue a warning, and essentially as long as you can, within a reasonable amount of time, get that grade back up, then that will appease that. If that grade does not respond in a timely manner, then we will have to start looking at potential dismissal. There is no extra credit work. There is no additional things that you can do to get extra points to get that grade up, because the program is designed at the foundation. Everything that is in the course is the course. Doing extra stuff to make up for lack of performance elsewhere dilutes the course progress and readiness for the module exams and the course final and national registry. 70% or higher on module exams, we just talked about that. And then we have homework and quizzes and assignments, and honestly, this is the number one thing that if you are going to start showing unsuccessful progress in the program, it is when you stop doing the homework and quizzes and the assignments. The entire program is built to where all of the assignments that are daily, weekly, for example, the quizzes are kind of our foundational piece, that the quizzes that you take, they help prep you for the module exam. The module exam prepares you for midterm and final. The midterm and final is designed to prepare you for national registry. Therefore, if you start lacking and not doing the quizzes, then you're not going to be prepared, and that has a downstream ripple effect. So stay on top of the assignments. If you don't do them, it will hinder you greatly. Complete the final exam with a 70. There is at the end of the course, it is a DSHS jurisprudence exam. There's a course tied to it. That is just, it's on the list here because it is a state requirement that we have to have in there. And then NIMS for National Incident Management System, which is your disaster response for the federal awareness. These, again, will be given to you and guided, but it is a checkbox that we have to have for the course. And then demonstrate any efforts to correct deficiencies throughout the course, and then adhere to the maximum course timeframes if needed. So this is, you're halfway through clinicals and you break your ankle, you can finish the course, but you can't finish your clinicals until a few weeks after the course is completed. There is a maximum time if needed, and that will be discussed if that is something that does come up. So, course tuition, current base fees is $1,380. That accounts for your course fees, the textbooks, the online platform, JB Learning, your first attempt on national registry. So at the end of the course, when you have other things like background checks that pop up, this is one less, it's already paid for, it's one less thing that you have to worry about paying, and remove that barrier to getting you to go test. That also includes your uniform shirt, and one thing that we do focus on is we do try to remove all the hidden fees as much as we can. And so there's other things that do need to pay for, but there's going to be no surprises such as, oh, you want a skills test? Oh, that's another fee. That is all part of the tuition. Payment plans are available, and you can look at those there. Just as awareness, there is a 3% credit card fee on all transactions. We do have some things, so here's the additional cost, the uniform supplies, so pants, and we'll go over the uniform here in a second. You may spend anywhere from $100 to $200. If you have it all already, then it would be $0. If you are bougie and really like the high dollar stuff, you could spend as much as you want. So adult BP cuff, stethoscope, physical and immunizations may vary depending on what you do or don't need. And then after the end of the course, and this is that licensing, you've got the state license fee, it's $64, and the fingerprinting fee, it's another $40, give or take. But with all trying to figure out what is a good stethoscope, what's not, what's a good blood pressure cuff, what's not, what we've done is we were able to put together these kits that have the blood pressure stethoscope, trauma shear, safety glasses, O2 wrench, pen light, and you can get those for $65, just the kit itself. Everything that's in there is of decent quality. I'm not going to say high quality because it doesn't compare to the $350 Littman stethoscope, but it is of adequate quality. You can find a stethoscope for $10. It will not work. I have seen it multiple times. It does not work for the student, and then they think that they cannot take a blood pressure, when in fact it has nothing to do with their capability, has everything to do with the poor quality equipment. But as an entry level, you may not know what is a good stethoscope or what is not a good stethoscope or everything else on the list. So what we were able to do is put these kits together for a decent cost and offer it. The $65 is just the kit. There's nothing else. There's no bag. If you want to, and they're pictured here, we have a blue or black bag option, and that is a $90, and that is with everything above plus the bag. And you'll be sent in the registration process a link of whether or not you do want this. You can add that into your process. So the things that we do provide as far as the uniform is we do the ID badge and the uniform shirt, and you can see them pictured here. There's a gray button down and our patches on the left shoulders. Additional uniform requirements, this is what you will need to bring and wear, is black work pants, typically cargo pants, and we can give some suggestions. Honestly, Amazon has them. You can go to Walmart, or there's some EMS supply places in the area. You can go to 511 if you want to spend the extra dollar and like that quality. Any of those are fine as long as they're black and they have a cargo pocket. We use them quite a bit to carry the supplies on us, so that's why we require it. Black work boots. So they need to go above the ankle for support and covers all of the foot. No tennis shoes, and then this is a work safety thing. We get in austere environments, we get on ditch banks, removing the risk of rolling the ankle. Black belt with no design, just a simple clasp. That's pretty straightforward. A black undershirt, and t-shirts are, it needs to be a t-shirt and free of any primary logos that you can see when you're wearing the uniform properly. Some things to remember is there are times that we do remove our uniform shirt in the classroom to either run scenarios or practice assessments, and it's important for you to understand that if you wear your uniform shirt but a highly inappropriate t-shirt underneath, especially if you're on duty or doing clinicals, that if you have to take that off, now you are in violation of the uniform because you are wearing a highly inappropriate undershirt. So just keep that in mind. Any suggestion would be go to somewhere cheap, find a nice, comfortable black t-shirt or two, and just make that your uniform shirt. Jackets, not required. Obviously, being in Houston, we don't have the need for jackets near as much. But if it does rain, if it is raining out, if it is in the colder season, if you do wear one, just make sure it's a plain black or blue. It can have some reflective. That's not a requirement, but make sure it's black or blue, and free of major slogans or logos. What we're referring to is like a large football team helmet on the back, or your fire department insignia, or any of that stuff. It needs to be neutral, because when you're in the student role, if you're with a department and you're wearing that department jacket, you're now representing that department, but you're on clinicals with us, and that's a conflict of interest. Some other things are just a professionalism of, if you're not wearing department style stuff, it needs to be a clear neutral. If it says North Face on the left breast, or if it says any other brand that is relatively a normal nameplate size on the jacket, that is completely fine. So black boots, again, needs to be above the support ankle for support and for safety reason. No revealing tops or shorts. That's pretty self-explanatory there. And facial hair must be clean and well trimmed, and must be able to wear an N95. Typically, we'll work through that individually early in class. Hairstyles need to be in good taste. So unnaturally hair colors and extreme styles do not present an appropriate professional experience. So again, if there's any questions about that, we will work with that early in the class, or you may reach out to Valerie and ask ahead of time. While in uniform, the long hairstyle should be worn and pulled back out of the face and neck. This has to do with safety, not only for you, but also for exposure, because if we are working on patients and there's blood or sputum or whatnot in the area and your hair is hanging over, and it's going to eventually get in on that. So the last thing you want to do is have nasties in your hair going home. The best place to practice for that is anytime you're in uniform, you wear your hair that way. That way is not unfamiliar to you by the time you get to patient side. Also, some personal appearance stuff. Excessive makeup is not permitted. Again, you can have makeup. We're not saying you're not authorized for makeup, but make sure it's balanced and in good taste. And it looks natural. When you get into the excessive reds and trying to get a little overboard, then we'll have to reel that in a little bit. Please take a shower and use deodorant. We're going to be in close proximity to patients. The last thing we want to do is give off an unpleasant odor, which does not come across as professional as well. And avoid perfume and cologne. That does not mean do not wear it. That means wear it in moderation. Excessive cologne and perfumes actually can exacerbate patients, make their nausea worse, their situation as a whole. So that's the last thing we want to do, is come to help and then make it worse. Jewelry should be not be functionally restrictive, dangerous to the job performance, or in excess. I know that's a very ambiguous description, but I'm going to we'll hit on this a little bit here with facial jewelry, no hoops or potential hazards. It has a lot to do with incidental snags, or sometimes patients grabbing. The last thing you want to do is have them grab a hoop and start yanking. If you have gauges, they need to be solid, again, for the snag and grab aspect of it. And if there's anything else in question, actually one thing would be studs. Make sure that anything that you do have facial jewelry-wise, best thing to do is swap it out with a neutral colored type stud. And that will resolve 95% of any questions or concerns. Outside of that, there's Valerie to reach out to clarify any questions or concerns you may have as far as that. Do not advertise for someone else's logos. We did kind of hit on this, but again, this brings in hats and shirts and jackets, any type of large logos. It does come down to a legal thing where when you put a jacket on or something with a large logo, in that case, you're now representing that other organization. Okay, this is where you need to pay attention very closely, because this will be the #1 headache that depends on how well we kick this class off. Immunizations and medical documents. So most all of us have these somewhere. If you were recently graduated, your school should have it. These are getting easier and easier to keep track of, as they've been required immunizations for quite some time. If you're older, it may be a little bit difficult reaching back. We've had individuals whose school hasn't existed in 20 years, and so we're going to work through that. So I'm just going to talk about each one of these, and I'm going to talk about the requirements. So MMR, measles, mumps, rubella, you have to have a record of receiving 2 immunizations, 2 shots. If you do not have that, but you know that you received it, you can go and get what's called a serology test. A serology test is basically just a blood test to see if you have the antibodies to the level that would defeat MMR. I will forewarn, in all of these, and MMR actually is 3, so since it's testing for 3 of them, you may get measles and mumps that you're immune to, but then find rubella you are not immune to. So at that point, then your doctor would prescribe whatever course of action they feel appropriate, which is typically just to get a booster, and then you would turn that in. The key from this is don't worry about the process. Just look at, you either need a record of the shots, the 2 of them, or you need a blood test. Hep B is the same way. Hep B is a 3-shot series, so you need a record of all 3 shots or a serology test. Varicella, also known as chickenpox, varicella 2 shots or serology. Some of you may have heard, or this was a standard for many years. As long as you had chickenpox, then it meant you were immune to chickenpox, and actually that has been debunked. It doesn't mean that you may not have some retained immunization from it or immunity from it, but we are finding more and more individuals who had chickenpox as a kid do not retain immunity when they get older. So if you are going to rely on that, do not be surprised that if you go get the serology test, that it comes back negative, and then you will have to get the 2-shot series. So if you do not have record of the 2 shots, you can get serology, or you can just go back and get your 2-shot series. Again, these are all things that you just have to decide for yourself and talk with your primary care physician. We're just laying out the options to be able to satisfy the minimum requirements. Tdap, or tetanus, and more specifically, the DAP is tetanus, diphtheria, and pertussis. It does need to be Tdap within the last 10 years. And current year influenza. Valerie will reach out to you a little bit more on this early in the class, just because if you're not in flu season, there may be some discretion or discrepancy on whether or not you do need to get it. So for example, the spring class typically may not have to get it because flu season's over and you're going to be out of class before the next flu season starts. So just kind of know that that's not an absolute requirement, as long as it's not in season, and it kind of depends on how the hospitals sway on this. What I will say is all of these requirements are generally to meet the hospital requirements. Trust me, we do not ask you to do anything above what is necessary. And as you notice here, thank God we don't have to worry about the COVID vaccine, and that has been removed in case anyone was concerned about that. There needs to be a physical completed the last 12 months. We talked about that. It, again, doesn't have to be anything specific, just a physical. If your doctor wants a physical, we do have a paper that they can that we can offer that they can sign. Otherwise, most physicians has a physical that they would sign off on this part of their department. TB tests and chest x-ray within the last 12 months. You only need a TB test. The only time you need a chest x-ray is if you have a positive TB test. Now, we are seeing more individuals who received the vaccine. If you had the vaccine, there's a good possibility that if you receive the TB test, that it will be a positive test. That doesn't necessarily mean that you have TB. It just means it is reacting to your body's immune level. So what is recommended in that case is that you get a blood test on the TB immunity or the vaccine immunity. We do offer the TB test here. Typically, it's around $20, give or take. The price does vary based on how much the TB test does cost. So we usually offer that early in the class. So you do not have to get that before the first day of class, but because we do offer it if you choose to go with us. So question is, what do I do from here? What's my next step? You have already submitted your interest into the program. Great. Next is enrollment. There'll be some communication after in this email for you to go in. I believe there's going to be a link, and that will take you to the enrollment documents where you will sign all the waivers and all the fun stuff and walk you through that. After that, you will submit your enrollment, and then you will receive within the next day or two a invoice, and possibly even the same day, an invoice for the course, and you can make payment. And we're going to talk about payments here in a little bit. And then you basically hang out and wait till the first day of class. However, I cannot stress enough that shop records from today till first day of class needs to be your priority. Everyone worries about, can I study anatomy and physiology, and can I study this? No. The course is designed to get you that information. Your focus from this day forth, if you're going to enroll in this program, is shop records, because it is the #1 hinderer in kicking the program off and taking class time dealing with shop records when we should be turning them all in the first day or within the first week of class. So please, I cannot stress that enough, focus on your shop records. Other things, you can shop around and purchase your diagnostic equipment if you choose to purchase it on your own. Again, we have those clinical kits where basically you can just purchase them and not have to stress out and try to figure out what to and what not, and what's going to work best or not. Insure finances, again, we have the payment plans. We're excited to be able to offer that. We were not always able to. And then discuss your schedule with your work and family. Again, when it kicks off, every other weekend, losing a day, having, one night a week, you're going to be away, straight from work typically to school to home and bed and then back to work the next morning. It does become challenging, but especially during the clinicals at the end, and especially getting ready for testing and finals, it's going to start taking a little bit more time. Make sure your work is prepared and they understand, for example, if you need to leave 15 minutes early to be able to make it class on time, to work with them ahead of time. Make sure your family understands that the next 14 weeks is going to be challenging, especially towards the end. But again, it's worth it. It's more about how we prepare versus getting halfway through it, realizing, oh crap, I didn't expect this. So what is due now? At minimum, you can pay the whole thing if you like. That is completely up to you. But at minimum, the payment to hold your spot in the course is a $650 non-refundable fee. The reason for that is when you pick that slot, that is now being tied to background check, drug test, purchasing books and codes, and so on and so forth. So that is associated directly to the hard costs that we have for you as a student. So otherwise, that is our program as a whole. Here is Valerie's contact information. If you don't already have it, you scan the QR code, it will pop up with her contact information. You can just click her contact card, and you just click Save as Contact, and feel free to reach out and email her, text her. Again, we ask that you respect times. Usually when it gets about 8 to 9 o'clock at night, we understand that you may be working during the day in our adult night class. Typically between that 5 to 8 o'clock, maybe communication heavy. That's to be expected. So, but any questions you have, we're here for you. We hope to see you in the classroom. We look forward to seeing you in the classroom. And again, thank you for taking the time, and let us know if you have any questions.